Thank you for joining us here on News 4. We are talking today about the sudden death of former Secretary of State Colin Powell. Powell's family says he was battling Parkinson's disease, also died from complications of COVID. He also had multiple myeloma, which is a form of plasma cancer that would have affected his immune system and his response to the COVID-19 vaccine, which he did have, and would have made it difficult for him to fight the virus. Today, doctors tell News 4 that deadly breakthrough infections are very rare. In fact, they say in most of the cases, they can point to an underlying risk factor as partly to blame. News 4's Caroline Hecker spoke with a local doctor who explains why context amidst the headlines here is key.
The death of General Colin Powell should not lead to concerns about the effectiveness of the COVID-19 vaccine. That's according to local doctors and government officials like Ian Sams, who tweeted, "Vaccines work. They prevent bad outcomes. They, like all vaccines, are not 100%, especially among older people with underlying or complicating health issues."
And of these very small groups of people who get hospitalized and die, it's a very, very small group, and most of those have a clearly defined risk factor, which is older age.
Powell was 84 years old and battling cancer, putting him at an increased risk of illness and death, even with the vaccine.
But I think we should be very careful about what conclusions we are drawing from this one person as opposed to the preponderance of the evidence that we have.
Jose says context is critically important when looking at the bigger picture of breakthrough cases. Nearly 187 million people have been vaccinated in the U.S. About 24,000 of those have been hospitalized with a breakthrough case. In all, 7,000 people have died. Just 0.004% of those fully vaccinated. In St. Louis, there are currently 299 people hospitalized with COVID-19. 66 of them are fully vaccinated, which comes out to 22%. The rest remain unvaccinated. News 4 has spoken with several people who have tested positive for COVID-19 long after receiving the vaccine.
I let my guard down, and this is how I got COVID, because I let my guard down.
The true number of breakthrough cases remains slightly unknown, as the CDC only collects information on breakthrough cases deemed severe enough for hospitalization. In St. Louis, Caroline Hecker, News 4.